How to test for Clonus in infants. If you're a parent or caregiver concerned about the health of your infant and wondering how to test for Clonus, this information is here to help you understand the process. Clonus is a neurological condition characterized by involuntary and rhythmic muscle contractions. In infants, it can be a sign of an underlying neurological issue. Here's how healthcare providers typically test for Clonus. First, the healthcare provider will perform a neurological exam to assess the infant's muscle reflexes. This is usually done by gently manipulating the infant's joints to check for any abnormal reflex responses. One common test is the ankle Clonus test. The provider will quickly flex the infant's foot upward, toward the shin, to stretch the gastrocnemius muscle in the calf. If the infant has Clonus, the foot will start to bounce up and down involuntarily. This bouncing can last for a few seconds or even several minutes, depending on the severity of the condition. Another way to test for Clonus is by checking the knee reflex. The provider will rapidly push the infant's kneecap, patella, toward the toes to see if the leg will involuntarily bounce up and down. This test helps to assess the reflexes and muscle tone in the infant's legs. During these tests, the healthcare provider is looking for sustained Clonus, which means the muscle contractions continue for more than 5 beats. If this happens, it is considered abnormal and may indicate an underlying neurological condition. In addition to these physical tests, the provider may also ask about any symptoms you've observed, such as muscle stiffness, spasms, or unusual movements. They might also perform other diagnostic tests like MRI scans, blood tests, or spinal fluid samples to determine the underlying cause of the Clonus. It's important to note that Clonus can be associated with various conditions, including cerebral palsy, brain injury, or other neurological disorders. If you notice any unusual muscle movements or spasms in your infant, it's crucial to consult with a healthcare provider for a thorough evaluation and diagnosis. Remember, early detection and diagnosis can make a significant difference in managing and treating neurological conditions. If you have any concerns, don't hesitate to reach out to your healthcare provider.